This is regarding me, and so a brief disclaimer before I officially start. I don't have any financial affiliations with any of the organization or any of the AI applications, which will be demonstrated during my lecture. This is here generative AI. Basically, it has gone long-standing evolution over the time from starting from 2024 till now, even before that as well. So it is basically transforming care delivery, and it is easing administrative burden and navigating the new era of the traditional medicine. As all of you already know, that artificial intelligence is basically a system of bots that use some specific domains to take over the things which will mostly do manually. So there is a rapid global adoption of AI over the last 3 to 4 years. Though the mean and the models which were developed were keep on started from 1956, but it came into evolution with a rapid development over the large language models and especially of the chat GPT. So over the first 1 year, we are only aware of the few large language models such as the chat GPT and Gemini and Grok. So now we have tons of new models. So there is a rapid global adoption, as you can see in the screen, that in 2020, the global AI in healthcare market was valued at 4.9 billion US dollars. And then it rises abruptly in 2024 to 45.2 billion US dollars, and now its annual growth rate is predicted as 45%, with the model now being estimated to 150 billion of US dollars regarding the AI. So there is a global adoption of AI, and healthcare is no more an exception. In healthcare, at first, it was just employed in content writing, in drafting summaries of the research, in research work, in only the research thing it was catering on. But now it has taken leaps and bounds in this field, and now predictive modeling, decision making, and automated tasks are being taken into consideration as well in healthcare. So first of all, we come to the introduction of generative AI. As we all are non-tech person, I'm talking about the healthcare professionals, allied healthcare professionals. So what is generative AI? Generative AI basically it is a sort of an AI with which the new content can be crafted by careful reasoning in the form of a written content, in the form of an audio content, in the form of an image file or a video content. So what is generative AI? Basically, you feed the system, you have developed an artificial system in a way that you have trained it with the logical reasoning, and then you put it in either a text file, either an audio or a video conversation or an image file, and then it matches it with the already embedded tokens of information which has in its system. It compares with the algorithms, it compares it with the system prompts, and it comes up with the new content. So definitely you have to give a prompt, and that prompt is only in the form of non-technical language, that is your usual language. Now the chatbots are being developed in different language models as well, and with the main large language models such as ChatGPT and Gemini, you can also interact in your own language as well. Though there are now large language models in specific languages like Urdu and some of the traditional languages as well. So this is basic framework how the generative AI works. So basically, how it is evident for a healthcare professional to take into consideration the generative AI. So actually, 40% of a physician's day is basically spent in maintaining the electronic health record data entry, and the inbox management. So basically, what the AI is most useful in it is that it takes over that time and it provides that time to a healthcare professional to use that precious time in consulting other patients, and actually it relieves the burnout of a clinician. So basically, the healthcare professional, they spend mostly 40% of their working hours on electronic health record data entry and inbox management. And this documentation drives clinical burnout and bleeds into the person they given the name of that pajama time. So with the AI intervention, with the generative AI in loop, it basically directly targets this inefficiency, returning critical hours to focus on what truly matters. So basically, what the generative AI comes, it takes into consideration the data entry process. With the AI in the loop, it can basically predict, it can take into consideration the patient's language. It interprets the data in the form of a clinical entry, or it can, if the entry has already been done manually, like a paper written notes, it can convert it into a nicely crafted typed information of that patient, and it can put it directly into the electronic health record as well. Uh, in this way, it definitely affects the direct patient care and complex clinical reasoning as well. So this is the brief context why we need AI in healthcare as well. This is a brief statistic regarding one study published in American Heart Association journal. So the value proposition is that with the help of AI, 70% of the physician time is being free up from administrative tasks, from data entry, from maintaining the electronic health record, and basically it increases 50% increase in patient throughput. Also, it gives 8 additional patients per day per physician. This is basically American study. So at least in that system as well, 8 additional patients per day per physician it gives. So basically, it leads to significant reduction in physicians' burnout and a dedicated attention to the patient it provides. And also it benefits in the form of some monetary expenses as well, additional up to $2 million per year. Basically, it saves. So how this shift is coming? So we have the previous models when the ChatGPT came, it was basically only a predictive sort of a thing or discriminative AI, and now we are into a stage where it is generative AI. So predictive AI is basically the only the classification and pattern recognition. We can ask it in a yes/no question that is this a tumor on a CT scan or not. Whereas in generative AI, the things are different. Now we have trained the set of models with our particular guidelines, clinical reasoning models, and also the imaging models as well. So the objective now is to synthesize, create, and reason that particular model. So whatever the output the generative AI gives, it basically comes up in the form of logical reasoning by taking into consideration the various models it has taken before. Okay, so I'll explain that in Urdu as well. So basically generative AI क्या है कि generative AI आप हेल्थ केयर में इसका रोल बेसिकली प्रिडिक्टिव डिसीजन मेकिंग में इस तरह है कि ये ऑलरेडी आप एक सिस्टम एल्गोरिदम एक चैट बॉट या एक एआई एजेंट डेवलप करते हैं बेस्ड ऑन सम स्पेसिफिक रीजनिंग मॉडल और उसमें आप क्लिनिकल गाइडलाइंस जो भी हैं सपोज देर आर गाइडलाइंस रिलेटेड टू आप अस्थमा में ट्रीटमेंट के लिए बेसिकली ब्रिटिश थोरेसिक सोसाइटी गाइडलाइंस यूज करते हैं तो उसमें आप एक सिस्टम को एम्बेड कर देते हैं उससे जब भी आपके पास कोई पेशेंट आएगा सपोज एक अस्थमा का पेशेंट आया आपने इनिशियल फाइंडिंग्स डाली जैसे कि वाइटल साइंस सो बेसिकली वो उसको मैच करेगा उस स्पेसिफिक क्लासिफिकेशन ऑफ द सिस्टम के साथ और देन इट गिव्स यू इट्स ओपिनियन. Okay, so and this is the same system with which you can work and you can draft a discharge summary and you can simulate disease progression as well. So clinical impact इसका क्या है कि generative AI does not simply retrieve data. ये यानी ये जो पुराना डेटा आपने फीड किया हुआ चैटबॉट में ये सिर्फ उसको रिट्रीव नहीं करता बट इट सिंथेसाइज रिस्पॉन्स बाय मैचिंग द जो ऑलरेडी प्रीसेट डेटा है उसके साथ मैच करके और अंडरस्टैंड करके मेडिकल प्रिंसिपल्स की बेस पे रीजन करके आपको एक आंसर देता है. So this is basically a shift in the last 3 years we have seen. Okay. So just like a bit, please don't have any side chat. If you have any question, you can write in the chat box, or so we can take it in the last 10 to 15 minutes. So this is the basically clinical impact of generative AI that is simply goes beyond the beyond its use in research to now what is it's used in predictive decision making and clinical reasoning. So basically, the three architectures which we are be discussing today and what they are being incorporated in our generative AI set for the healthcare professionals. These are basically the large language models, and these large language models are basically ChatGPT, Gemini, Grok, Mistral. There are a lot of these large language models. And then we have the image creation models that are the diffusion models, and then there are large multi-model models. They are basically being employed in clinical practice nowadays. So large language models are what? So it is basically text to text generation. It is used for synthesizing clinical notes, drafting patient letters, and summarizing extensive health records. So the example for this is that suppose you have in place a system where you are manually taking notes, and then you have preset columns for each and everything. So you manually fill up that data, and then you have crafted a chatbot which the internal system has provided you. Many of the hospitals in Pakistan now they are going to this electronic health record, and they have a destined set of performer for that. So you feed your information into that large language model, and it comes up in the form of a very structured report. So these reports can be made just in the form of a chatbot, like you put the patient, whatever the notes you have taken from the patient history notes, you put it, and then once you have provided a proper structure, it comes up with a very nicely crafted clinical notes. Then patient referral letters you can generate with the help of large language models, and then you can summarize the extensive health record of the patient with this as well. Then comes the diffusion models. Now, diffusion models have gone an enormous development during the last few years, and it is where in radiology, basically the generative AI we employed. Mostly nowadays, generative AI is being making leaps and bounds in the form of fields like radiology, diagnostic pathology, histopathology, and basically the diagnostic fields. So the diffusion models are basically used to iteratively denialize the data to create high fidelity synthetic X-rays, counterfactual skin lesions for dermatology training, and 3D models. So with the help of diffusion models, once you have an X-ray, you can basically like make it more refined, or you can explain that in the form of a text as well. Or it can also be these diffusion models to craft the dermatology training materials, 3D models for anatomy coaching, medical education. So a wide variety of its applications are there. Then third one is the large multi-model models. So these multi-models are what in this you feed the data either in the form of an audio file, in the form of an image, in the form of a photograph, or in the form of a descriptive text generation. So it processes multiple data types simultaneously in real time, interpreting radiology images alongside unstructured patient history records. So basically, these large multimodal models are being used by highly specialized hospitals nowadays. And what it does, it interprets basically in the clinician room, these models are being deployed. So it picks the patient voice, convert it into an English language or a structured clinical notes. It takes into context the like the lab reports of the patients. It takes into context any histopathology report. It integrates with the system it has already being used in, and then it comes up with predictive decision making predictions, making some giving some suggestions about the diagnosis of the patient, what may be the differential diagnosis, what may be the steps ahead. So these multimodal models are being currently employed nowadays, taking into concept the generative AI. So what we have, basically the strategic goal we have is to take into consideration the patient experience, the overall health of the population. Then we have to cut the cost of the system as well. We have to reduce the cost, and also we have to provide the work-life balance as well. So हमारा बेसिकली हेल्थ केयर में एम क्या है कि पेशेंट एक्सपीरियंस इंप्रूव हो, एंगेजमेंट विद द पेशेंट इंप्रूव हो, आप पेशेंट को जो आप डिस्चार्ज समरीज दे रहे हैं वो कंप्यूटर ट्रांसलेशंस में कन्वर्ट होके दे सकते हैं, कम्युनिकेशन लेवल जो है वो इनहेंस कर सकता है विद द हेल्प ऑफ दीज मॉडल्स। फिर आपके है पॉपुलेशन हेल्थ को आप टेक इनटू कंसिडरेशन कर रहे हैं कि विद दिस डिसीजन रिस्क मॉडलिंग आप एक तो अपना कॉस्ट को कम कर रहे हैं, दूसरा आप पेशेंट की जो हेल्थ के बारे में डिसीजंस हैं उसको मोर अप्रोप्रिएटिवली ले रहे हैं, टेकिंग इनटू कंसिडरेशन हम स्पेसिफिक गाइडलाइंस रूल्स दैट इज द हिपर रेगुलेशंस। इसके साथ आप सब चीज का जो कॉस्ट रिडक्शन है वो कर रहे हैं। सपोज इफ यू गो फ्रॉम अ पेपर बेस्ड सिस्टम ऑफ क्लिनिकल नोट्स टू इलेक्ट्रॉनिक हेल्थ रिकॉर्ड, सो बेसिकली यू हैव कट द कॉस्ट ऑन पेपर। आपको जो इनकी कॉस्ट पेपर की कॉस्ट आ रही है वो सारी आपको रिसाइकलिंग जो कॉस्ट है वो आपको यूज नहीं करनी पड़ी, और आपको सारा का सारा सिस्टम जो है वो एक सॉफ्टवेयर में इलेक्ट्रॉनिक हेल्थ रिकॉर्ड की सूरत में अवेलेबल है। Then, apart from all this, you provide a basically a work-life balance for a physician, escaping the data entry trap। आप data entry के जो मुख्तलिफ steps हैं उसके hurdle से निकल सकते हैं, और इस सारे का impact ये है कि overall जो आपका health care system है वो जो है more impactful और more properly design होता जा रहा है। देयर आर द फ्यू यूज केसेस। फर्स्ट ऑफ ऑल है कि आप कीबोर्ड को एलिमिनेट करते जा रहे हैं, उसमें आपका जो क्लिनिकल डॉक्यूमेंटेशन का मॉडल है मॉडर्न हेल्थ केयर में जो जनरेटिव एआई हेल्थ केयर में यूज हो रहा है, उसमें यह है कि आप क्लिनिशियन के रूम में जनरेटिव एआई का मॉडल डिप्लॉय किया जाता है, लार्ज लैंग्वेज मॉडल, एंड इट पिक्स द पेशेंट वॉइस इन द फॉर्म ऑफ एनी लैंग्वेज। सपोज द पेशेंट इज कम्युनिकेटिंग इन उर्दू लैंग्वेज, so it picks up and then it reasons it। It basically securely listens to the clinical patient conversation, उसमें से जो important information है उसको वो extract करेगा speaker, और extract relevant clinical nuances को देखते हुए, and then it forms the format। जो लोग इससे available यानी already अवेयर हैं, इस सोप क्राइटेरिया होता है सब्जेक्टिव ऑब्जेक्टिव असेसमेंट और पेशेंट कंसिडरेशन को लेते हुए, तो उसके फॉर्मेट में ये इसको बेसिकली क्राफ्ट करता है, एंड देन इट रिव्यूज, इट एडिट्स एंड ऑफिशियली pushes to the electronic health record। So this is the model being currently employed with the help of large multimodal models। So first of all, it listens to the clinical patient interaction, extract important information, format it in the form of a clinical format according to the SOAP criteria, and then it reviews the information. It keeps on reviewing the clinical lab investigations as well, and comes up with few predictions about the prognosis of the patient, about the proper diagnosis, and what may be the management guidelines according to it. So we have the clinical impact is that it returns undivided doctor-patient attention, driving both patient satisfaction and diagnostic accuracy। इसमें ह्यूमन को इस लूप से नहीं निकाला जा सकता, जो पेशेंट का इंटरेक्शन है ह्यूमन के साथ उसको खत्म नहीं किया जा सकता। तो ह्यूमन बीइंग वी टेक इट एज अ पायलट, एंड बेसिकली द एआई थिंग इज हैंडलिंग द नेविगेशन ऑफ दैट सिस्टम। Then comes the diagnostic support and safe medical reasoning। अब इसमें क्या है मॉडल है, बेसिकली आप इनपुट करते हैं complex history of the patient either in the form of a photograph, audio file, or in the form of some text file, and it retrieves the information from that complex history। It basically queries massive updated clinical guidelines जो पहले ही सिस्टम में embedded है, like the न्यू इंग्लैंड जर्नल ऑफ मेडिसिन की गाइडलाइंस का एग्जांपल दिया हुआ इधर, and then it basically comes up with a synthesized personalized treatment plan। So trainees and clinician often spend this mostly 5 से ज़्यादा मिनट लगते हैं पर 15 मिनट एनकाउंटर को। अगर उसने कोई हिस्ट्री ली है पेशेंट की और उसको आप जब टाइप करने बैठते हैं या आप लिखने बैठते हैं तो एटलीस्ट इट टेक्स मोर 5 मिनट्स पर क्लिनिशियन फॉर सपोज अ 50 पेज कॉम्प्लेक्स पेशेंट हिस्ट्रीज। तो इस केसेस में एक रिट्रीवल ऑगमेंटेड जनरेशन है कि रिट्रीव करता है फिर उसको ऑगमेंट करता है, एंड देन इट जनरेट्स बेस्ड on the information already embedded in its system. So retrieval augmented generation, it grounds the AI instead of relying on pre-trained memory. सिर्फ pre-trained memory पे rely नहीं करता, वो retrieve भी करता है और वो फिर verifiable जो clinical guidelines हैं उनको quote भी करता है before generating a proper answer. दो इसमें कुछ hallucination के जो concepts हैं वो होते हैं, but still it works in a very nice and fine model. ट्रेडिशनल वर्कफ्लो जो है वो मैनुअल वर्कफ्लो होता था। बेसिकली अनस्ट्रक्चर्ड लैब रिजल्ट्स को आप कंपाइल करने में क्रॉस रेफरेंसिंग विद सम पॉलिसीज। सपोज एक पेशेंट है जो किसी और नेशनलिटी का है, जो इंश्योरेंस पॉलिसी में आता है, या इंश्योरेंस का अगर मॉडल डिप्लॉय किया तो कौन सी पॉलिसी उस पर लगती है। तो इस सारे को जनरेटिव एआई के वर्कफ्लो से स्ट्रक्चर किया जा सकता है। अनस्ट्रक्चर्ड लैब रिजल्ट्स और क्लिनिकल नोट्स को ऑटो कोड्स और मैचेस टू ऑथराइजेशन रूल, और फिर एक ऑडिट रेडी प्रायर ऑथराइजेशन रैशनेल या ट्रीटमेंट प्लान जनरेट किया जा सकता है। बेसिकली इसका सारे का एम क्या है कि इट स्पीड्स अप द पेशेंट एक्सेस टू केयर while eliminating hours of back office administrative gridlock। जो एडमिनिस्ट्रेटिव टास्क हैं उनको कर, सपोज एक इसकी एग्जांपल ये है कि अगर एक वार्ड में नर्सेस मैनुअली पेशेंट की मेडिसिन मंगवा रही हैं पहले, और उनके पास एक स्टॉक है, लेकिन अगर एआई मॉडल डिप्लॉय किया हुआ है तो इट इट गिव्स प्रिडिक्टिव कंफर्मेशन दैट ये वाला आईवी फ्लूइड खत्म हो रहा है या ये मेडिसिन स्टॉक में खत्म हो रही है। सो इट बेसिकली एनहांस द प्रोसेस। और अगर ये एक ऑटोमेटेड सिस्टम वैसे ही डिप्लॉय कर दिया जाए तो once they are using that medicine, once it is running off the stock, so already फार्मेसी या लैब में वो ऑलरेडी एक यानी एक पिंग जनरेट किया जा सकता है, एक बजट जनरेट किया जा सकता है कि ऑलरेडी इस एरिया में मेडिकेशंस जो है वो खत्म हो गई। सो दीज आर ऑल यूज केसेस। सो क्रॉस स्पेशलिटी इम्पैक्ट मैट्रिक्स क्या है कि फार्मेसी के साथ, जैसे मैंने एक एग्जांपल दी, नर्सिंग के साथ सिंथेसाइजिंग रियल टाइम मॉनिटरिंग समरीज, ये नर्सेज के नोट्स बहुत ज़्यादा होते हैं, उनकी मॉनिटरिंग समरी यानी जनरेट की जा सकती है। कॉग्निटिव ओवरलोड को ड्यूरिंग द शिफ्ट हैंड ऑफ्स कम किया जा सकता है विद द हेल्प ऑफ दीज मॉडल्स। नोट्स आर मोर स्ट्रक्चरली क्रिएटेड, तो हैंड ऑफ्स में इजी हैंड ऑफ किया जा सकता है, अपार्ट फ्रॉम के मैनुअली किया जाए उसमें कुछ चीज़ें मिस भी हो सकती हैं। सोशल वर्क, ऑटोमेटेड ट्रांसमिशन ऑफ क्लाइंट सेशंस एंड रियल टाइम रिस्क असेसमेंट, अर्ली क्राइसिस इंटरवेंशन कोई कर रहे हैं तो उसमें इसका यूज हो सकता है। फिर रेडियोलॉजी में इमेज जनरेशन और कन्वर्जन फॉर फास्टर स्कैन टाइम्स, क्लियर लीजन डिटेक्शन, तो ये इसमें इसका एक बहुत यूजफुल इम्पैक्ट है। बेसिकली इमेजिंग और डायग्नोस्टिक पर्पस में जनरेटिव एआई बहुत तेजी से ग्रो कर रही है आगे। इसके अलावा साइंटिफिक रिसर्च में एआई का बहुत ज़्यादा रोल है, और ये जो साइंटिफिक रिसर्च का प्रोसेस है ये सिर्फ स्पीड पे ही डिपेंड नहीं करता, बट क्लिनिकल एक्यूरेसी और रेलिवेंस पे भी डिपेंड करता है। So integrating AI into healthcare research is not just about speeding up the process. सिर्फ आपने speed नहीं करना, it is about achieving more accurate, reliable results that can transform patient outcomes. Ultimate goal क्या होना चाहिए कि patient outcome, सिर्फ speedy results ही आपके पास नहीं आएंगे, they are more accurate, more reliable। जितना बड़ा data set है, एक मैनुअल बंदा, एक आम इंसान अगर उसको 6 घंटे लेता है, तो ये मॉडल इट टेक्स मे बी 4 to 5 minutes to quickly analyze and come up with the results. Though it can be still, it has to be verified as well. So basically, AI can help in each and every step of writing and publishing a scientific manuscript. It starts from brainstorming research question. You have some idea, suppose you have some idea of doing research on a cerebral palsy patient, and now you are looking into particular domain that cerebral palsy and physical rehabilitation, how they are correlated, physical rehabilitation can work in it or not, or any other domain. So you can put these ideas together in a large language model and you can brainstorm further ideas or research questions. Then literature search, reading articles, summarizing the article, extracting the data from the article. It becomes very easy with the help of these AI models. There are a lot of tools nowadays, such as SciSpace, Elicit. They can basically generate the few summaries. They can extract the data from those articles very reliably. So then the questionnaire creation and data collection tools. questionnaire creation with the help of Google tools, Google Forms, Microsoft Forms. It has become very easy apart from the manual data questionnaire creation. Then the data collection also is very easy with the help of advent of AI, with the help of these models. Data collection analysis of the data is like AI systems, if they are properly trained and properly aligned according to the guidelines, they can be like more faster, more accurate, and more reliable as compared to the manual data sets. Then manuscript writing. This is like a long time we are using language, grammar, references, citations. There are a lot of citations manager for manuscript writing as well. And apart from that, journal selection as well. AI can handle each and every task of your research work. But they doesn't come up straight away. There are a few ethical hurdles in between. They are basically limitation and algorithmic harms while dealing with the human data, because in healthcare we are dealing with the human data. So first of all, generative AI systems have a habit of hallucinations. From 2022, still the nature of these hallucinations are not that much reduced as compared to it was previously it was previously told. But still, the AI systems are there. They can hallucinate. Regarding hallucinations means that वो अपने own पे कुछ false information generate कर सकते हैं. Okay, so these generative models are, they are basically prediction engines. They are not databases of truth. वो हमेशा सच नहीं बोलते. कॉन्फिडेंटली वो फैब्रिकेट भी कर सकते हैं. आपने लार्ज लैंग्वेज मॉडल के साथ इंटरेक्ट करते हुए चैट जीपीटी से देखा ही होगा कि मोस्टली उसको आपकी हाँ में हाँ मिलाने की काफी वो उसको होती है. इनएक्यूरेट रेफरेंसेस जनरेट कर सकता है, इनएक्यूरेट इंफॉर्मेशन जनरेट कर सकता है, और इस फॉर्म में हेलुसिनेट कर सकता है. जैसे इस तरीके के हाइपरटेंसिव पेशेंट इज ऑन मेडिकेशन, दे आर नॉट एक्चुअली टेकिंग. तो यानी अगर नोट्स की बात आए तो वैसी इंफॉर्मेशन जनरेट कर सकता है जो कि हेलुसिनेशन के मॉडल में आता है. तो इसको आपने क्विकली इसको वेरीफाई करना होता है. देन कम्स द एल्गोरिथमिक बायस. जो ट्रेनिंग डेटा है, दे कैन perpetuate false race-based medicine or fail to accurately evaluate diverse skin tones in dermatology. ये dermatology की एग्जांपल दी गई है, लेकिन ये जो algorithmic bias है ये डिफरेंट पॉपुलेशंस पे लागू हो सकता है अगर इसको प्रॉपरली नॉट ट्रेन किया गया है स्पेसिफिक पॉपुलेशन के लिए. सो इट कम्स अप विद अ रॉन्ग और फॉल्स जनरेशन ऑफ सम सर्टेन फैक्ट्स. इसके अलावा lack of interpretability where clinician cannot easily trace how a neural network arrive at a specific conclusion. यानी कुछ black box algorithms ऐसे होते हैं कि वो क्विकली डिफाइन नहीं कर पा रहा कि वो कैसे इस कंक्लूजन पे पहुंचा है. तो उसकी इंटरप्रेटेबिलिटी एज अ क्लिनिशियन हमारे पास इजीली ट्रेसेबल नहीं होती. So these are the few ethical concerns. Hallucination is a major concern, algorithmic bias, and then lack of interpretability. So clinical studies show that in some unstructured tests, up to 20% of LLM responses contain inappropriate or potentially unsafe मेडिकल रीजनिंग. सो 20% है. सपोज अगर एक आपने टूल डेवलप किया और उसको प्रॉपर रीजन किया, अलाइन किया, अगर वो 99% एक्यूरेट है लेकिन 1% इनएक्यूरेट है, सो इट मे लीड टू फॉल्स रिजल्ट्स with the help of with using these hallucinations. So for this purpose, whenever we take into AI in healthcare, we also take that human in the loop must always be present. So a human must always be there. That human must always be there to basically interpret or verify the responses of a generative AI health system. सो हमारे पास कुछ प्राइवेसी स्पेसिफिक रेगुलेशंस और स्पेशल गवर्नेंस के मॉडल्स हैं. इनको लाजमी जो कंसिडरेशन में रखना है व्हेन एवर यू आर यूजिंग एआई इन हेल्थ केयर. इसमें हिपा रेगुलेशंस आर मोस्ट स्पेसिफिक. द सीवियर डेंजर ऑफ पब्लिक प्रोप्राइटरी मॉडल्स एक्सपोजिंग सेंसिटिव पेशेंट हेल्थ इंफॉर्मेशन. आपने हेल्थ इंफॉर्मेशन आप vulnerable होती है with the help of these AI models that it can get leaked. vulnerabilities of that model, threat of data extraction and jailbreaking prompt to bypass safety guardrails. फिर enterprise solution आप deploy कर सकते हैं, localized deployment कर सकते हैं, shifting toward domain specific open weighted models deployed safely behind a hospital own secure firewall. ये firewall की कुछ technical terms है, आप firewall develop कर सकते हैं और एक specific एक hospital के लिए enterprise solution है. Then adhering to the global standards, हमारे पास WHO की एक body है, governance guidance for multi-model generative models in health settings. उन सारे को take into consideration लेना whenever you are using AI in specific health domain. Okay, so basically the mitigation क्या है कि non-negotiable oversight. आप human is always a pilot when we are taking consideration of AI in healthcare, and AI is basically navigator. It helps you in taking of some administrative tasks, taking into consideration document synthesis, taking into consideration making discharge summaries, take into consideration some specific extraction of the data from clinical notes. But the human is always there in the loop. A human is the pilot. He has to verify this before it goes on to the patient. So human in the loop is always there in AI and healthcare. So generative AI must never make autonomous final diagnostic or treatment decisions. वो अपने own पे कोई final treatment decisions नहीं कर रही. एक qualified human physician हमेशा उसके जो आउटपुट्स हैं उनको वेरीफाई करेगा अगेंस्ट क्लिनिकल नॉलेज. So auditing the black box, we can use generative AI to audit other AI. So by generating counterfactuals, experts can isolate exactly which clinical feature the AI is using to make decisions. So इसको इन generative AI models को use किया जा सकता है other AI tools को correct करने के लिए by making factual decisions. So ultimate rule क्या है कि AI is a clinical superpower designed to enhance human expertise but not replaced by empathy. जो empathy का element है वो अभी तक ये large language model नहीं provide कर सके और इसी वजह से जो concept है super AI का where they say that AI will surpass the human thinking ability वो अभी तक evolution में नहीं आया. देन जजमेंट एंड बेडसाइड मैनर ऑफ द प्रोवाइडेड. तो एआई कभी भी रिप्लेस नहीं कर सकती एम्पैथी, जजमेंट और बेडसाइड मैनर ऑफ हेल्थ केयर प्रोवाइडर्स. और इसी वजह से जो कुछ लोग कहते हैं कि एआई विल रिप्लेस फिजिशियंस, तो एआई विल नेवर बी गोइंग टू रिप्लेस द फिजिशियंस. ये कुछ 2024 से लेके जो आपकी आजकल की ग्रोथ है एआई की हेल्थ केयर मॉडल्स में और ओवरऑल ग्रोथ है उसमें है कि 2024 में हमारे पास को पायलट्स थे जो कि एक डॉक्यूमेंट्स को समराइज कर सकता था. हम जो टेक्स्ट पढ़ रहे हैं उसको वो इलेबोरेट कर सकता था. एम्बिएंट ये मेडिकल स्क्राइब में बहुत यूज होता है, अभी भी यूज होता है एम्बिएंट स्क्राइबिंग एंड ऑटोमेटेड इनबॉक्स मैनेजमेंट टू कम्बैट बर्नआउट. फिर उसके बाद मल्टी मॉडल इंटीग्रेशन आया जिसको मैंने एक्सप्लेन किया कि मल्टी मॉडल के वो इमेज के फॉर्म में भी इनपुट ले लेगा, टेक्स्ट के फॉर्म में भी ले लेगा, ऑडियो की फॉर्म में भी ले लेगा और फिर उसको वो एनालाइज करेगा टेक्स्ट को, मेडिकल इमेजेस को, लैब रिजल्ट को साइमल्टेनियसली. 2028 में प्रेडिक्टेड है कि प्रिसीजन मेडिसिन का कॉन्सेप्ट ज्यादा आएगा कि एआई ड्रिवन पर्सनलाइज्ड ट्रीटमेंट प्लान्स बेस्ड ऑन पेशेंट की जो जीनोमिक्स है उसको देखते हुए बियॉन्ड द स्टेट केयर. और ऑटोनोमस मॉनिटरिंग का भी कॉन्सेप्ट है 2030 प्लस में. continuous predictive monitoring system that foresee and prevent critical events before they happen. But ये अभी unrealistic सा ही goal लग रहा है. I don't think so they will be going to achieve it. A few feature trends are करंट ट्रेंड क्या है कि पैसिव असिस्टेंट के तौर पे यूज हो रहा है स्पेसिफिक आइसोलेटेड क्लिनिकल टास्क के लिए, समरीज के लिए. आप प्रॉम्प्ट देते हैं, आपके डॉक्यूमेंट को समराइज कर देता है, आप प्रॉम्प्ट देते हैं, स्ट्रक्चर फॉर्मेट पे इलेबोरेट कर देता है. बट नाउ इट गोइंग फ्रॉम चैटबॉट्स सिंपल टू एजेंट्स. द रिस्क ऑफ एजेंटिक एआई, मल्टीपल जो एआई एजेंट्स है इसका राइज आ रहा है. एजेंट्स, एआई एजेंट्स और व्हाट एआई एजेंट्स वो सिस्टम है कि चैटबॉट में आपको उसको चैट करना पड़ता है, लेकिन एजेंट में आप पहले ही इस टास्क के लिए उसको डिफाइन कर देंगे और जब उसको डिप्लॉय करेंगे तो विद अ सिंगल वन वर्ड प्रॉम्प्ट इट विल लीड टू लाइक फुल टास्क. So autonomously execute complex multi-step clinical workflows behind the scenes. मल्टी मॉडल कन्वर्जेंस की भी बात हो रही है जो हमने अभी बात की है। तो हाइपर प्रिसीजन मेडिसिन डिलीवर्ड डायनेमिकली एज द पेशेंट डेटा अपडेट सेकंड बाय सेकंड। ग्रोथ इसमें हो रही है, बट स्टिल दिस मल्टी मॉडल कन्वर्जेंस इट कैन टेक सम टाइम फॉर फर्दर डेवलपमेंट। कुछ कैरियर्स जो एआई इन हेल्थ केयर में आ रहे हैं उसमें बेस्ड क्लिनिकल एक्सपर्टीज की कोई दो राय नहीं है कि वो लूप में से निकल सकती है। विद द हेल्प ऑफ दीज एआई एजेंट्स एंड मल्टी मॉडल रीजनिंग के जो मॉडल्स हैं उस पे एआई इंजीनियरिंग का एक कंसेप्ट आ रहा है, उसमें एजेंट डेवलपमेंट है, चैटबॉट डेवलपमेंट है, ये सारी चीज़ें हैं। द फ्यूचर ऑफ मेडिसिन एग्जिस्ट हियर, न्यू प्रोफेशनल रोल्स, क्लिनिकल एआई लाइजेंस के रोल्स आ रहे हैं, मेडिकल प्रॉम्प्ट इंजीनियर्स के आ रहे हैं कि हेल्थ केयर में प्रॉम्प्ट्स कौन बेहतर लिख सकता है। एआई गवर्नेंस ऑफिसर्स हैं, इसके अलावा कंटेंट क्रिएशन एंड कंटेंट राइटिंग की जो फील्ड है वो पहले ही बहुत डेवलप की है विद द हेल्प ऑफ विद द एडवेंट ऑफ एआई। इसके अलावा मेडिकल स्क्राइब की जो जॉब्स हैं, मेडिकल स्क्राइब की जॉब्स लाइक रॉड जो पेशेंट का डाटा है उसको एक स्ट्रक्चर्ड फॉर्मेट में इलेक्ट्रॉनिक हेल्थ रिकॉर्ड में एम्बेड करने का, मेडिकल बिलिंग, मेडिकल कोडिंग, इसके जो फील्ड्स हैं वो वैसे ही डेवलप बड़े किए हैं आफ्टर द एडवेंट ऑफ एआई। So clinical AI liaison, they bridge the gap between the technical development team and frontline healthcare providers, prompt engineers, they craft precise, safe clinical queries for optimal model outputs. This is also on rise. Then AI governance officers, ऐसे AI governance officers की जरूरत पड़ेगी जो ethical, unbiased and secure AI deployment at enterprise level ensure करेंगे। सो की टेक अवे क्या है कि एआई लिटरेसी इज नाउ अ कोर कॉम्पिटेंसी इन मेडिकल एजुकेशन। और मेडिकल एजुकेशन में इसलिए एचईसी ने पाकिस्तान में भी 3 क्रेडिट आवर्स हर बैचलर डिग्री में रखे हैं। और मेडिकल साइंस में कहीं इसका कोई नेमुल बदल नहीं है। यू जस्ट हैव टू अंडरस्टैंड व्हाट द एआई मॉडल्स आर बीइंग यूज्ड, you have to deploy it in your medical education. Large language models already you people are using, but these models you have to take into consideration while medical education, your medical education, your clinical work, you are optimizing your administrative tasks while you are at job. So core principles of integration है कि augmentation not replacement. So AI a clinical superpower है designed to enhance human expertise, but goal is to return empathy and eye contact to the examination room. So आप augmentation के तौर पे तो इसे यूज कर सकते हैं, replacement के तौर पे नहीं यूज कर सकते। हेल्थ केयर में जब भी जनरेटिव एआई की बात आएगी तो ह्यूमन इन द लूप इज ऑलवेज देयर। इट विल क्लिनिकल ओवरसाइट इज नॉन निगोशिएबल, नेसेसिटी फॉर पेशेंट सेफ्टी केस पे कोई निगोशिएशन नहीं हो सकती। मिटिगेटिंग द इनहेरेंट रिस्क ऑफ हेलुसिनेशन और एल्गोरिथमिक बायस जो कि ये एआई मॉडल जनरेट करते हैं। देन आपने कोई भी जो एआई मॉडल है उसको सिर्फ इसलिए यूज नहीं करना कि वो नया है, नोवल है, बट यू हैव टू बेसिकली टेक इनटू कंसिडरेशन कि वो आउटकम्स कैसे दे रहा है। So implementation must always prioritize equitable patient outcomes, proven diagnostic accuracy, and practical clinical relief over the hype of new technology. Okay, so brief question for all of you: will AI replace doctors? So just you can answer in the chat box. What you think? So will AI replace doctors? You can answer in the chat box. So never, yes, no. So we have got a few answers. Yes, you are pretty right. Yes, AI will not never be able to replace. So all of you are correct, basically. So generative AI, it will not replace healthcare professionals, but professionals who use generative AI will replace those who don't. So that's why we are advocating the use of generative AI, but take into consideration the ethical circumstances, take into consideration that these AI models are tend to hallucinate, they produce algorithmic bias, they make predictive proclaims which are not correct. So you have to incorporate generative AI into your daily personal and professional tasks, yet take into consideration ethical policies as well. So ultimate goal of this technology is not to mechanize healthcare, but to eliminate the data entry clerk trap, allowing us to reclaim the human art of compassionate care. Okay. So with this, we come to the end of our presentation. So AI is designed to become your most powerful clinical co-pilot, but not your replacement. So let's build the future of medicine together with by using AI. So the house is open now for questions. If you have any questions for me, You can ask. There is possibility AI doctors, but still there are few clinics being built in China, and I think there is one in Saudi Arabia as well. But still, they are taking into a human in loop domain because there are a lot of just now somebody mentioned in the chat as well that there is a death as well, and also a well-known case where a person used to take some deficiency of some salt he has, and then he come with bromide poisoning as well. How to get a job remotely? Okay, so for getting the job remotely, first you have to take into consideration these skills. First of all, the foremost skill for you people is to build the AI literacy framework. First of all, take into consideration how you can craft an effective prompt. So prompt engineer's job you can found in a few networks such as Fiverr, Upwork, medical billing coding. There are few courses. Afterwards, you can take a certification exam, though it costs a bit, maybe 1 lakh, 2 lakh. Then there are specific firms in Islamabad, Lahore, and Karachi. You can contact with them and you can work with them. But you can work on your own as well once you have enough certification knowledge as well. Data exploitation in this generative, yes, you can ask whatever your question is. Yes, data exploitation is always a risk when you are using generative AI model. That's why we take into consideration in healthcare the HIPAA models, the standard WHO care, and also a specific model being designed for every healthcare institution. So you can ask your question like in the chat, or if you can unmute yourself, you can unmute yourself as well. RAG is retrieval augmented generation. So retrieval augmented generation is basically that it retrieves the information, then it augments how you have prompted it, and then it comes up with the new response. So once it has retrieved the information, then it augments some specific response, and then it comes up with the new generation of a response based on whatever you have prompted and whatever the model it says. So PHPI is basically public and health professional involvement. It is basically a research collaborating body. Okay, I think there is some more question in the chat box. Let me see. Where can I learn generative AI in healthcare to be proficient in relevant prompt engineering? Okay, regarding relevant prompt engineering, there are some specific courses, especially if you can go to Coursera or Udemy also has some specific prompt engineering courses, but more on there is one healthcare course of Stanford as well, AI in healthcare, that is very nicely elaborated. Then there are few prompt engineering courses as per the healthcare perspective on Coursera. So you can take it from there. In Pakistan, cooperating generative AI in their healthcare, yes, a few hospitals such as the Shifa Hospital in Islamabad, it is being using Shaukat Khanam in Lahore and Aga Khan. So all these JCI accredited. There are a few in other in Lahore as well. They are also employing these AI models into their system. Perfect language to make a supervised learning model. You have to you don't need nowadays for making some specific model, you don't need any coding language, but you need some vibe coding means that you code along with the same language which we are speaking, English or Urdu. English language you can use and you can make these models. So vibe coding, a lot of courses are there. The same I'll suggest Coursera or Udemy. But there are some people who are Python engineers and coding experts. They are also teaching vibe coding. So with this, you can learn AI agents, and then you can make your own agentic AI solutions as well. We can get these people. Yes, it will be provided as per the GRIN policies. It will be provided. Charge that patient's data could be misused, like nowadays, where ChatGPT is reported to be involved in the war conditions going on, specifically in precision medicine with genetic data. Yes, the data can be exploited. So for this, some specific guardrails, temporary chat whenever you have some specific data of your own, never to upload your own files. Once you have a specific employed system that is designed specifically for that hospitals, so then you can definitely upload your own data. If we are going to apply generative AI in drug discovery, how I apply model in real world, want to apply AI in, yes, in AI in drug discovery is basically first of all regarding that specific molecule which you are developing, any pronounced model previously built for that, and then some specific annotations or some specific automations made with the help of agentic AI can help in AI in drug discovery. There are any other question from any of you? We still have 7 minutes remaining. So I hope you people have enjoyed, and it has basically, though it was just a 1 hour, so it has basically like added new information to your already embedded knowledge of generative AI, and you can take into consideration. And we can have some future workshops or webinars for that as well. Roadmap for AI developer. First of all, prompt engineering. Once you have learned prompt engineering, then see how these AI models they work. Specific language, large language models, how to interact with them. Use these large language model to create small videos, small images. Once you have done that, and you have taken into command of prompt engineering, then what you can do is you can go for learning vibe coding. With vibe coding, you can learn how to make small agents, small chatbots, small apps. Once you have made that, then you can be an AI developer as well. Some of the AI tools used for AI in healthcare, Google MedTech is being used in healthcare. Then these all large language model, ChatGPT, Grok, Gemini, they are being employed. Google Docs is now very much employed in the electronic health records, and with this combined with Google Forms, the hospitals are making the electronic health record very simplified. Then for the research purpose, Elicit, SciSpace, I have mentioned, our discoveries, there is one as well. So there are a lot of models related to, okay, welcome Kamza. And what are some of the AI tools? Recording मिल सकती है. Which programming language code is more preferred for AI, Python or Java? Actually, you don't need to learn all the Python. Just a background knowledge and basic how like the command is being employed in Python. Python is more preferred as compared to Java. Enjoying learning. So thank you very much for joining. Javiria and Misam have done all the things till AI agent developer. Now in the field of coding for AI development, I want to now the next roadmap after all of the things till vibe coding. So once you have learned vibe coding, now you can employ and you can test these models. For this, currently in Pakistan, you have to contact with some specific company or some other hospitals as well for these agents. Yes. Okay. Anybody has any other? Okay. So there is another question. Suggest
Assalamualaikum,
any
sir.
topic in medicine that need more work and we need to use AI and create a project. Okay. So create a project somebody is already said that they know vibe coding, make a simple app and then test that app in your specific system. So this can be I made one vibe coding app that is that triaging of the patients presenting to the emergency department. So take a scale like Canadian Triage and Equity Scale, make a small app with vibe coding and test it in your healthcare settings by taking permission from your healthcare administration, and then you can write a paper on that as well. So a lot of things you can do on AI. Attendance have been says health educator. Which path you suggest? Health educator, like for health educators, this AI thing is good. Like for public health awareness, AI has a lot of room in AI in public health, so you can use that. What after that app? Then you can deploy that app For that, you need take help from some Python engineer as well. Anyone who knows Python, how to deploy that vibe coded app. And once you have taken permission, you can do it on a small subset of patients as a pilot project, and you can write a paper as well. Medical billing and pharmacovigilance, but for mode setting, it's hard to get job. You can kindly, yes, you can contact with a few centers in Islamabad and Karachi and Lahore. So big cities have that centers, and remotely also. First, try to do some internship with them, and then you can get the job on your own. Anyone has any other question?
Please unmute yourself.
Yes.
Assalamualaikum.
जी वालेकुम अस्सलाम.
Sir, I'm Muqaddas Shah. As a final year cardiovascular sciences student, I'm looking to use the AI in the cardiac catheterization laboratory, basically in interventional cardiology, for research or procedures. How can generative AI be utilized?
फॉर कार्डिक कैथेटराइजेशन. कार्डिक कैथेटराइजेशन में बेसिकली जनरेटिव एआई एक तो ये है कि ये डिसीजन मेकिंग में पहले आपको गाइड कर सकती है कि किस आर्टरी को आपने बैलून करना है, किसको जो परफ्यूजन है वो क्या है. लेकिन उसके लिए एक बैकग्राउंड मॉडल पूरा डेवलप करना पड़ेगा. अगर तो कोई पहले ही एम्प्लॉयड है आपके हॉस्पिटल में, वहाँ पे ये यूज़ किया जा सकता है. देन प्रिडिक्टिव डिसीजन मेकिंग में ये यूज़ हो सकता है कि अगर उस पेशेंट की एनजीओ आपके पास है और आप एआई को एम्प्लॉय कर सकते हैं बेस्ड ऑन वंस यू हैव ट्रेन दैट मॉडल टू सी दैट लाइक व्हाट मे बी द precision clinical precision or decision making for that specific patient. तो कार्डिक कैथेटराइजेशन में तो इस तरह का रोल हो सकता है, लेकिन आपको कोई ना कोई मॉडल पहले डेवलप करना पड़ेगा जिसको प्रॉपर ट्रेन किया जाए सबसेट ऑफ पेशेंट्स में. I hope you are being able to follow. Anyone has any other question? So thank you everyone for joining. Please fill out this form for the certificate, and it's a useful learning with all of you today, and a lot of interesting questions from all of you as well. So if anybody has any other question, you can ask from me
Assalamualaikum to all.
जी वालेकुम अस्सलाम.
Before we conclude the session, may I request you, Sir Irfan, to please share your valuable feedback at the session before this end. Sir Irfan, my platform is yours now.
Assalamualaikum, sir. Thank you so much. I would like to thank Dr. Rehan for your time and for providing valuable information. जिस तरह सर ने जो है ना वो जनरेटिव एआई के बारे में बताया कि वो हेल्थ केयर के अंदर किस तरह जो है ना वो अपना एक अहम रोल अदा करती है, आई थिंक इट्स वैल्यूएबल इंफॉर्मेशन. और जिस तरह आप सर ने ये भी बात की है कि जो पाइथन को सीखने के बाद जो है ना वाइब कोडिंग की तरफ जा सकते हैं एज अ नॉन टेक बैकग्राउंड जो है ना, आई थिंक इट्स फर्स्ट स्टेप. आप जो है ना वो पाइथन सीखें, आफ्टर पाइथन आप जो है ना नेक्स्ट वाइब कोडिंग की तरफ मूव कर सकते हैं और स्टेप बाय स्टेप आप जनरेटिव एआई की तरफ भी जा सकते हैं. और सेकंड, हमारे कुछ वेबिनार्स वगैरह जो है ना वो आ रहे हैं. 13 को हमारा जो है ना एक लिंक्डइन के बारे में लिंक्डइन मास्टरी कोर्स होगा, ठीक है, जिसके अंदर हमारे पास जो एक्सपर्ट मेंटोर हैं अब्दुल मई साहब, ठीक है, फ्रॉम यूके. हम उसके ऊपर जो है ना वो लिंक्डइन के बारे में देखेंगे कि लिंक्डइन किस तरह जो है ना वो हमें हेल्प कर सकती है टू गेट जॉब. राइट. आप जिस भी बैकग्राउंड से हैं, आप हेल्थ केयर बैकग्राउंड से हैं, डबल ई के बैकग्राउंड से, जो भी बैकग्राउंड का आपका है, ठीक है, तो लिंक्डइन इज योर फर्स्ट रिज्यूमे. तो आप मेक श्योर करें कि आप जो है ना वो लिंक्डइन को ज्वाइन करें, आप हमारे साथ कनेक्ट रहें. तो इंशाल्लाह हमारे पास और भी बहुत से जो है ना वेरिएबल सेशंस आ रहे हैं. अभी हमारे एक रिसेंटली जो है ना वो चल रहा है रमजान सीरीज के अबाउट, जिसमें हमारे पास एक्सपर्ट टॉप पर्सन अवेलेबल होते हैं फॉर योर क्यूरी. आपको डाइटिशियन के हवाले से जो भी क्वेश्चन हो, आप जो है ना यू कैन आस्क फॉर योर आंसर. Thank you so much again, sir, for your time and for providing valuable information. Thank you so much for your audience. आप लोगों ने टाइम निकाला. Thank you so much, man.
Thank you very much for providing the opportunity.